Hello and good day, and welcome to wherever you are listening to us today. It is Friday, 23 April 2021. My name is Christian Lindmeier, and I'm welcoming you to today's special event, the one-year anniversary virtual event for the Accelerator, the ACT Accelerator. We have a long list of special guests, which I will spare you from reading through now, and you've all seen the media advisory, hopefully. I will leave it to the Director General, of course, to make the introduction to all our special guests. Simultaneous interpretation is provided in the 6 official languages: Arabic, Chinese, French, English, Spanish, and Russian, plus we have Portuguese and Hindi. Now, present in the room today are Dr. Tedros Adhanom Ghebreyesus, WHO Director General; Dr. Bruce Aylward, Special Advisor to the Director General and the lead on the ACT Accelerator; Dr. Soumya Swaminathan, the Chief Scientist of WHO; and Dr. Hanan Balki, Assistant Director General for Antimicrobial Resistance. We have other colleagues and more colleagues online who will join us later in the question and answer session. Now let me hand over to the Director General, Dr. Tedros, for the opening remarks and for our special guests. The floor is yours.
Thank you, Christian. Good morning, good afternoon, and good evening. When COVID-19 emerged almost 16 months ago, we knew that we already had effective tools to prevent infections and save lives in the form of fundamental public health measures. Those measures continue to be the backbone of the response in all countries. But we also knew that we would need new tools: diagnostics to test for this new virus, therapeutics to treat it, and vaccines to prevent it. At the same time, we knew that we live in an inequitable world, a world in which children die from diseases that can be easily prevented with vaccines, and in which people die because their sickness goes undiagnosed and untreated. We knew that unless we took unprecedented action, the world's have-nots would be left behind again. So a year ago, WHO and the many partners who have joined us today came together to launch a unique initiative, the Access to COVID-19 Tools Accelerator. The ACT Accelerator was conceived with 2 aims: the rapid development of vaccines, diagnostics, and therapeutics, and equitable access to those tools. The first objective has been achieved. We now have several safe and effective vaccines to prevent COVID-19. We have rapid diagnostics tests for it. And we have oxygen and dexamethasone to treat it. But we have a long way to go on the second objective. Around the world, people are dying because they're not vaccinated, they're not tested, and they're not treated. We're deeply concerned about the increasing number of cases and deaths in India right now. We know that the situation is complex and requires different responses in different parts of the country. And I welcome the steps the government has taken to reduce social mixing and boost vaccine production. I offer my deep condolences to everyone in India who has lost someone they love, and I offer my deep commitment that WHO and our partners in the ACT Accelerator stand with the government and people of India and will do everything we can to save as many lives as we can. WHO has redeployed 2,600 staff from our other programs on polio, TB, neglected tropical diseases, and immunization programs to support states to respond. We're also providing technical support for the production of oxygen plants and advice on clinical management, including patient triage. The situation in India is a devastating reminder of what this virus can do and why we must marshal every tool against it in a comprehensive and integrated approach. Public health measures, vaccines, diagnostics, and therapeutics. This is a scenario that's playing out around the world and will continue to play out unless we ensure equitable access to the tools needed to save lives. The solution is straightforward. We need countries and companies that control the resources that could save lives to share. That means sharing financial resources to fully fund the ACT Accelerator. It means sharing vaccine doses to protect the most at risk, not just the most rich. It means all countries being transparent about their bilateral dose donations so we know who has what. And it means sharing technology, know-how, and intellectual property to urgently and massively scale up production. The ACT Accelerator needs $19 billion this year. That's a drop in the ocean compared with the trillions of dollars governments are spending on supporting their economies and the massive revenues that most vaccine makers are generating. It's not good enough to say that inequity is just the way the world is. It's not okay that people just like you and me die when we have the tools that could save them. We cannot accept the same old story. This is the time for all of us to write a new story, a better story that sees nations not as rivals or competitors, but as members of one human family with a common future. Call me an idealist. I will wear that badge with pride. In many ways, that's what the ACT Accelerator is. One family of governments, agencies, civil society, the private sector, philanthropists, and others coming together to find shared solutions to our shared challenge. No one of us can do this alone. Creating the ACT Accelerator was an achievement in itself, but leading it and running it has been an enormous and often unseen task. In September last year, we established a facilitation council led by South Africa and Norway to provide high-level political leadership and advice to facilitate the ACT Accelerator's work. It's now my great honor to welcome His Excellency, President Cyril Ramaphosa, the President of South Africa. Your Excellency, thank you for your outstanding leadership and support for the ACT Accelerator. You have the floor.
Director General of the World Health Organization, Dr. Tedros Ghebreyesus, Your Excellencies and colleagues, and Deputy Secretary General of the United Nations, ministers, and ladies and gentlemen. It is indeed my privilege to be part of this anniversary event for the Access to COVID-19 Tools Accelerator. Just over a year ago, on the 24th of April, 2020, we made a commitment to fight the COVID-19 pandemic together as a united front. When we established this collaboration, it was to ensure that diagnostics, therapeutics, and indeed vaccines for COVID-19 would be accessible to all. And in the end, we were committed that no country should be left behind. We have indeed come a long way. Since its establishment, the ACT Accelerator has supported the fastest, most coordinated, and successful global effort in history to develop tools to fight a disease. We have supported over 70 countries to expand laboratory infrastructure and ramp up testing. Through the Health Systems Connector, we have been able to assess country readiness for vaccine development and deployment in more than 140 countries. We've also established a common knowledge sharing platform where we are able to share each other's experiences. And we've also procured personal protective equipment with a value of more than $500 million. Through COVAX, we have been able to deliver more than 38 million doses of life-saving vaccines to over 100 countries. However, we have a great deal of work to do to ensure equitable access to rapid diagnostics, oxygen, and dexamethasone. This will be done through the therapeutics pillar and the COVID-19 Oxygen Emergency Task Force. We should say that vaccine nationalism seriously threatens the global recovery from the pandemic and is deepening inequality between countries. The COVID-19 vaccine is a public good and must be recognized as such. To overcome challenges with access, low and medium income countries must be supported. Yes, to have access to vaccines, but also to be able to manufacture their own vaccines, diagnostics, and other treatments. As a continent, Africa has embarked on an ambitious drive to work towards the development of pharmaceutical manufacturing capacity so that it can supply the continent's people with the vaccines and other medical supplies they need. To use the existing vaccine manufacturing capacity in developing countries and to enable further development, South Africa and India are calling for a temporary TRIPS waiver to respond to COVID-19. This, in our view, will facilitate the transfer of technology and international property to more countries for the production of COVID-19 vaccines, as well as diagnostics and treatments. We are greatly encouraged by the strong support for the TRIPS waiver proposal from over 100 countries, as well as from 130 civil society organizations, as well as a group of 70 former world leaders and more than 100 Nobel laureates. We welcome the initiative by the World Health Organization to establish a COVID-19 mRNA vaccine technology transfer hub. We call on the pharmaceutical industry to directly transfer this technology free of intellectual property barriers to low and middle income countries through either the WHO hub or the COVAX facility. And we appeal to the international community to help mobilize the $19 billion urgently required by ACT Accelerator to implement its 2021 priorities. Just as we worked together to ensure equitable access to medicines to respond to the HIV/AIDS pandemic, I think we should work together now, much more so now, largely because COVID-19 has encompassed the whole world and affected so many people, all at one go around the world. Let us together challenge vaccine nationalism and ensure that protecting intellectual property rights does not come at the expense of human lives. This is all the more pressing as many countries now face a resurgence of infections. As we have done so effectively in the past year, I'd like to believe that we can continue to confront this global health crisis in a spirit of solidarity, in a spirit of partnership as well. Let's face it, it is only through collaboration that we will be able to overcome this devastating pandemic. In my view, there is no other way in which we can confront this pandemic other than working in a collaborative way, in a cooperative way, and standing together instead of standing against each other. Now, ACT Accelerator has enabled us to work so close together in an unprecedented way. Let us take this great lesson for working together forward and be united in everything that we do. I thank you, and this is a great moment to bask in the wonderful work that we have done over a year and prepare ourselves for greater things that lie ahead. So thank you very much. I'm delighted to be part of this event. Thank you.
Thank you. Thank you so much indeed, Your Excellency, and my deep appreciation once again for your exemplary leadership domestically, regionally, and globally. It's now my pleasure to welcome His Excellency Dag Inge Ulstein, the Minister of International Development of Norway. Minister, thank you for your leadership as co-chair of the ACT Accelerator Facilitation Council and for joining us today. You have the floor.
Thank you so much, Dr. Tedros, Excellencies, President Ramaphosa, colleagues, friends. It has been a year full of contradictions, a year of confusion, consternation, competition, and cooperation. Bad news and worse news have been competing for our attention. But there has indeed been some good news too. The virus has shown to what a degree we all share the same destiny, while also demonstrating dramatic degrees of inequality, expanding existing gaps even more. 1 year ago, we were keeping our fingers crossed that a new vaccine against a new virus could be developed within a year, even if we knew that at least 6 years was normal. But it happened much sooner. Together, we have managed to turn ACT Accelerator and COVAX into unprecedented mechanisms of international cooperation, an unprecedented response to a pandemic without precedent in modern times. Faced with a virus that is totally disrespectful of borders, our fight against it must also cross borders. We all understand this. However, it seems to me somehow as if the leaders of the world still haven't fully woken up to the fact that the coronavirus is capable of crossing borders. Continued lack of financing for the ACT Accelerator poses a major obstacle to its ability to deliver at scale. If we are to bring the pandemic under control, there is an urgent need to close the funding gap of $19 billion. A further delay in the funding will cost more lives and even greater economic harm. As long as the pandemic is allowed to prosper in poor countries, it may not just mutate and produce new variants that are dispatched to countries that are already vaccinated, it will also keep the world economy from regaining speed. As co-chairs of ACT Accelerator, President Ramaphosa of South Africa and Prime Minister Solberg of Norway have sent out letters to 89 countries asking them to contribute their fair share. Together with other members of the Facilitation Council, we are actively engaging in bilateral outreach to secure funding. At this one-year anniversary, our choice is simple. Invest in saving lives by treating the cause of the pandemic everywhere, now, or continue to spend trillions on the consequences of the pandemic with no end in sight. The case for global collaboration couldn't be stronger. As a colleague said in the last ACT-A meeting, a once-in-a-100-year event requires a once-in-a-100-year level response of cooperation and global solidarity. We cannot relax until everyone, everywhere, has access to vaccines, tests, and treatments. The time to act, to accelerate, is now. Thank you, and over to you again, Dr. Tedros.
Thank you. Thank you so much, Minister. I have enormously valued your leadership and friendship over the past year. And thank you so much again. Since the earliest discussions about the ACT Accelerator, and throughout the past year, the President of the European Commission, Ursula von der Leyen, has been a steadfast partner. I thank President von der Leyen for her leadership and partnership, and it's my honor to welcome her to make a statement.
Dear Dr. Tedros, distinguished guests, I remember very vividly those days of April last year. The world had been caught by surprise by the pandemic, and the response of too many leaders was my country first. We made a different choice. We knew that we needed to fight this virus not just at home, but in all continents and all countries, from Asia's mega cities to Africa's most remote villages. And for this, we needed to act fast and act together. And this is how the ACT Accelerator was born. I am proud that Europe was part of its inception from day one, and a special thanks to you, dear Dr. Tedros, and the team at WHO for getting the ACT Accelerator off the ground so quickly. And many, many thanks also to you, dear Cyril Ramaphosa and dear Erna Solberg, for taking on the leadership of the Facilitation Council. Already in early May 2020, Europe co-hosted a first pledging conference to raise money for this initiative. Many other pledging events followed suit. Europe helped raise billions of euros for ACT Accelerator. But what I really love about ACT Accelerator is the team spirit. ACT Accelerator wasn't created as a new institution, but a new way of working together. We all mobilized. The World Health Organization and national governments, UN agencies and philanthropists, NGOs, and the pharma industry, because every one of us has something to contribute. ACT Accelerator brought together all health actors and empowered them to do more and better together. Thanks to this cooperation, ACT Accelerator has achieved so much in so little time. ACT Accelerator helped identify a life-saving therapy against COVID. Thanks to ACT Accelerator, COVID tests are now available in low-income countries for less than $3. and its vaccine pillar, COVAX, is now shipping vaccines at an affordable price or for free to over 100 countries. None of us could do this alone. But together, we achieved a miracle. Every cent that we put into ACT Accelerator has been a good investment. And we will need more of this in the months ahead. Because the pandemic is far from over, we need ACT Accelerator perhaps even more than 1 year ago to track the virus as it evolves, to scale up manufacturing, to deliver vaccines to all corners of the world. ACT Accelerator has a funding gap of $22 billion. The European Commission has just doubled its contribution, and let me invite all governments, but also the private sector, to step up. Because this is how we can end the pandemic. Joining forces as a team, as Team Human. This is the spirit of ACT Accelerator. And Europe is playing for the team. Happy birthday, ACT Accelerator.
Thank you so much. Happy birthday, ACT Accelerator. One of the first and most decisive calls we had early last year at the ACT Accelerator was starting to take shape was with President Emmanuel Macron of France. And President Macron has continued to take an active interest and to play an active role in the ACT Accelerator. To mark this first anniversary, we have asked President Macron to reflect on the year that has passed and to look forward to the opportunities and challenges that lie ahead.
Monsieur le Directeur Général, cher Dr Tedros, Mesdames et Messieurs les chefs d'État et de gouvernement, chers amis, dès l'annonce de la pandémie par l'Organisation mondiale de la santé en mars 2020, j'ai annoncé que je prendrais au nom de la France, et des Françaises et des Français, une initiative de solidarité internationale. Car face au virus, la sécurité sanitaire de nos concitoyens exige une action internationale efficace. Nous ne pouvons pas laisser s'effondrer des systèmes de santé, nous ne pouvons pas laisser le virus hors de contrôle sur des territoires entiers. L'apparition de nouveaux variants en témoigne. Notre santé se joue aussi dans les pays les plus pauvres. Nous tous qui sommes aujourd'hui réunis avons travaillé d'arrache-pied pour mettre en place en urgence un outil qui nous permettait de répondre à cette ambition. Donner à tous accès aux produits de lutte contre le Covid-19. C'était le 24 avril 2020, l'accélérateur ACTA était né. Un an plus tard, nous pouvons être collectivement fiers de ce que nous avons accompli, même si beaucoup reste à faire. 11 milliards de dollars ont été mobilisés, 191 pays ont rejoint le mécanisme d'achat groupé des vaccins, appelé COVAX. Les volumes sécurisés permettront d'atteindre la cible que nous nous étions donnée de couvrir 20% de la population. Je souhaite que nous puissions aller plus loin, en particulier vis-à-vis du continent africain. Plus de 40 millions de doses de vaccins ont déjà été distribuées dans 114 pays. Ces quelques chiffres, ces quelques réalités, ce sont les premières réussites de l'initiative ACT-A, lancée il y a donc maintenant un an. Mais désormais, il nous faut continuer nos efforts, aller plus vite, plus fort, parce que c'est une guerre de vitesse contre la pandémie. Aujourd'hui, la situation n'est, malgré tous les chiffres que je viens de dire, pas satisfaisante. On a 1 personne sur 6 qui a reçu au moins une dose de vaccin en Europe. Nous avons 1 personne sur 5 qui en a reçu en Amérique du Nord. Et à côté de cela, en Afrique, c'est moins d'1 sur 100. C'est inacceptable. Il y a une première réponse très simple, à laquelle tous les États qui ont acheté des produits Covid peuvent avoir recours. Et je voudrais vous dire aujourd'hui solennellement que tous ceux qui ont précommandé des vaccins, beaucoup de vaccins, la France en fait partie, l'Union européenne en fait partie, nous avons une responsabilité à l'égard du reste du monde. Nous le savions, en particulier en Europe, lorsque nous avons signé des contrats d'approvisionnement avec tous les plus grands laboratoires. Une de nos conditions en tant qu'acheteurs était de pouvoir un jour donner ou revendre nos doses. Nous ne voulions pas prendre le risque de priver le reste du monde de ces vaccins si précieux. Maintenant, Le temps est venu de partager. Nous avons évidemment une campagne vaccinale à mener dans chacun de nos pays. Nos populations les plus vulnérables sont progressivement couvertes. Et nous allons continuer de recevoir de plus en plus de vaccins. Et nous avons largement les moyens d'accélérer notre solidarité qui passe par le don de doses. C'est pourquoi je vous annonce aujourd'hui que la France vient d'envoyer les premières doses destinées à COVAX. Ces doses AstraZeneca s'envolent à l'heure où je vous parle vers l'Afrique de l'Ouest, conformément au mécanisme d'allocation équitable de COVAX. Notre objectif, par ces dons, est de permettre à tous les pays, notamment en Afrique, de vacciner leurs populations les plus prises, en commençant d'ailleurs par les personnels de santé. Cet engagement, nous l'avions pris ensemble au G7 en février dernier et nous le tiendrons d'ici au mois de juin. Bien sûr, nous allons partager de plus en plus de vaccins, au moins 500 000 doses d'ici mi-juin, avec un panier de vaccins de plus en plus diversifié pour répondre aussi aux différents enjeux de la population que COVAX doit servir. L'essentiel dans cet engagement, je crois, est que nous ayons fait le choix de donner à COVAX. En effet, l'allocation des vaccins doit être fondée sur des critères objectifs que seule l'Organisation mondiale de la santé, à travers le mécanisme COVAX et le rôle qu'elle y joue, est en capacité de nous donner. C'est pourquoi j'appelle aujourd'hui tous mes confrères qui sont aussi dans cette situation à s'engager à partager des doses de vaccins. J'avais évoqué la cible de 5% en février, mais je peux d'ores et déjà vous dire que celle-ci sera dépassée en ce qui nous concerne avant la fin de l'année. Il y a ensuite beaucoup d'autres choses, on le sait bien, que nous devons faire, mais le don de doses est absolument essentiel. Alors en tant qu'État, nous avons beaucoup d'autres choses pour rendre plus concret l'accès de tous aux outils de lutte contre la Covid. Assurer toute la transparence sur les contrats d'approvisionnement afin de lutter contre les pratiques commerciales injustes envers les pays les plus vulnérables. Le système international aujourd'hui est trop opaque. Les critères de livraison, les conditions, les dates, les prix. Ensuite, garantir que nous mobilisons toutes les capacités de production de vaccins existantes ou prêtes à être transformées partout dans le monde. Aucun continent ne doit être exclu de la carte de la production. C'est essentiel et cela implique de soutenir les accords de licence et les transferts de technologie. Nous entendons beaucoup parler, en effet, de transfert ou d'absence de propriété intellectuelle. Le sujet, nous le savons aujourd'hui, n'est pas celui-là. C'est celui du transfert de technologie, de la mobilisation des capacités de production. Parce que le goulet d'étranglement est là. Ici, j'appelle très clairement tous les producteurs de vaccins à engager une telle démarche. L'accès global est une responsabilité collective. Les États, les organisations internationales ont un rôle essentiel à jouer, et le secteur privé également. Et donc nous devons tous nous engager autour du Medicine Patent Pool pour identifier les capacités de production sous-utilisées, pour maximiser et accélérer le transfert de technologie et permettre de produire plus de doses de vaccins utiles. Ensuite, la vaccination est essentielle, mais pour être efficace, elle doit aussi être accompagnée. Elle doit être accompagnée d'abord d'un renforcement de nos capacités de diagnostic et de séquençage, afin de suivre et lutter efficacement contre les variants. Je veux ici souligner le travail exceptionnel qui a été fait par la CDC Africa, soutenue par l'AFD, par nos instituts de recherche et le réseau des instituts Pasteur. Ce projet permettra de mieux connaître le profil de la pandémie en Afrique, limiter les risques de mortalité chez les personnes les plus vulnérables et d'orienter les choix d'achat de vaccins. La vaccination doit ensuite être accompagnée d'un véritable mouvement structurel de renforcement des systèmes de santé, qui est la pierre angulaire de toute forme de lutte contre les pandémies. Nous devons en effet nous assurer qu'ils sortent plus forts de cette crise. C'est une priorité centrale à mes yeux, et l'Agence française de développement a d'ores et déjà engagé des montants très conséquents, 1,2 milliard d'euros l'an dernier, et nous venons de valider à nouveau 1 milliard d'euros dédiés à aider les systèmes de santé pour lutter contre la Covid. Le sommet du 21 mai de l'Assemblée mondiale de la santé qui suivra permettra justement d'acter tous nos points de rendez-vous sur ces sujets. Nous devrons répondre aux enjeux d'aujourd'hui pour dessiner une sortie de crise collective et solidaire. Nous devrons aussi bâtir sur cette expérience hors du commun toutes les leçons pour repenser l'architecture mondiale de la santé. Celle-ci devra être plus robuste, plus inclusive, sera aussi plus efficace pour faire face aux futures pandémies. Une organisation mondiale de la santé réformée, renforcée, doit en être la pierre angulaire. Beaucoup de choses se jouent aujourd'hui. La crédibilité même du multilatéralisme en matière de santé se joue aujourd'hui dans notre capacité à livrer rapidement des doses sur le terrain, en Amérique latine, Amérique du Sud, en Afrique entre autres, dans le Pacifique également. C'est à nous de faire. Et donc je compte sur chacun d'entre nous, nous serons là. Je vous remercie.
Thank you so much, Your Excellency President Macron. And thank you to you and France for your generous donation to COVAX. I hope other countries will soon follow your example. The strength of the ACT Accelerator is that it has been supported strongly by governments all over the world. Now it's my honor to introduce three leaders who have been unwavering in their support. Prime Minister Mario Draghi of Italy, President Paul Kagame of Rwanda, and President Pedro Sanchez of Spain.
Director General, dear colleagues, the pandemic has shown us the importance of international collaboration in the realm of public health. Viruses and infectious diseases know no borders. COVID-19 quickly spread from China to the rest of the world and has claimed so far at least 3 million lives globally. Regrettably, our initial response lacked coordination. The global community failed to share information promptly and adequately. We struggled to understand that what was happening to another country would quickly happen to us too. Global threats require global responses. We will not be completely safe until all countries are safe. The ACT Accelerator, born a year ago, is an excellent example of what we can achieve when we work together. It aims to support the development and equitable distribution of the tests, treatments, and vaccines needed to bring the pandemic under control. It treats global health for what it really is, a public good. This is why, since its inception, Italy has been amongst its strongest supporters and main contributors. We now see an end to the worst of this pandemic. Thanks to global cooperation, scientists have developed a number of effective vaccines that can save lives and help us return to a normal life. But this success cannot be a source of complacency. We have to be more ambitious. We need to scale up research and development to fight new variants. We need to strengthen our health systems. We need to ensure equitable access to diagnostics, therapeutics, and vaccines, also in low-income countries. This year, Italy holds the presidency of the G20. Overcoming the pandemic and ensuring a sustainable and resilient recovery are at the heart of our agenda. We have emphasized the role of the accelerator in fostering global immunization according to transparent, agreed rules. We want to scale up the capability of the COVAX facility to achieve equitable distribution of safe and effective vaccines. Thank you.
Excellencies, WHO Director General Dr. Tedros Adhanom, distinguished ladies and gentlemen, I am pleased to join you in marking this first anniversary of the access to COVID-19 Tools Accelerator and commend Dr. Tedros and the WHO for leading this important response to the global pandemic. For many developing countries, the ACT Accelerator has been the only way to access life-saving COVID-19 testing kits, vaccines, and treatment. As the pandemic continues to evolve, often in an unpredictable manner, much more needs to be done to remove barriers to affordability and equitable distribution. In particular, Africa lags behind in the manufacture of vital products for COVID-19 prevention and management. Efforts are underway to build this capacity, but this requires support across the board to ensure that it's done properly and quickly enough to make a difference in the ongoing pandemic and improve preparedness for the next one. Rwanda remains committed to the goals of the ACT Accelerator. By now, there are lessons to learn in order to make this effort more effective. We will continue to work together with the WHO and other partners to defeat the COVID-19 pandemic. I thank you.
Hace un año nacía una iniciativa inédita y necesaria, el ACT Accelerator, destinado a impulsar el acceso a herramientas contra la COVID-19 a través de diagnósticos, terapias o vacunas. La situación era de máxima urgencia. La mayoría de los países europeos estábamos en un confinamiento mayor o menor. En España fue muy estricto y por aquel entonces el número de fallecidos era, por desgracia, aún muy alto. Un año después tenemos motivos para la esperanza. En un creciente número de países, las últimas horas del virus están siendo algo menos agresivas gracias a la vacunación, que empieza a hacer notar sus efectos positivos. Estamos también mejor organizados, concienciados para hacer frente a los contagios y sabemos que no debemos bajar la guardia. En este camino, en estos 365 días, el ACT Accelerator ha jugado un papel fundamental. En primer lugar, como punto de encuentro para debatir sobre las mejores respuestas para combatir la COVID-19, el ACT ha permitido que tanto Estados como organizaciones internacionales, ONGs, asociaciones, nos sentemos juntos, sin jerarquías, a afrontar este desafío con la eficacia y la solidaridad como únicas máximas en común. Y ha funcionado. Y en segundo lugar, como mecanismo para recaudar fondos, repartirlos, intentando equilibrar las donaciones entre los pilares que más lo necesitaban y atrayendo también al sector privado y a otro tipo de organizaciones, incluyendo bancos regionales y bancos globales. Y en tercer lugar, como acervo de lecciones aprendidas y formas de trabajar juntos de cara al futuro. Con independencia de la duración de la ACT en sí, su lección de eficiencia y agilidad, a mi juicio, es intemporal. España está hoy muy orgullosa de haber coliderado esta iniciativa y de pertenecer a su Facilitation Council.
Yeah, thank you so much. And now we move to the UN. As you know, WHO is proud to play a role in ACT Accelerator, but we have only done so as part of the United Nations, and with its support, it's now my honor to introduce Amina Mohammed, the Deputy Secretary General of the United Nations.
Director General, Dr. Tedros, my brother, Excellencies, distinguished guests, the ACT Accelerator has been a critical multilateral instrument in responding to the COVID-19 pandemic. It is saving lives, it is enabling societies and economies to begin the job of recovery, and it is giving us hope. As we mark the ACT Accelerator's first anniversary, it is sobering to look back at the devastating impact of this crisis. COVID-19 has taken more than 3 million lives. It has infected more than 140 million people all over the world. And the virus continues to rage. The pandemic has revealed stark, wide-ranging global fragilities and disparities, including in access to COVID-19 tools, treatments, and vaccines. If we are to successfully combat the pandemic and halt its impact on health and economies, greater global solidarity is crucial. We need coordinated investments in research and development, stepped up production and widespread deployment of effective vaccines, diagnostics and treatments to all regions and countries. That is why the ACT Accelerator was created. 1 year on, we see its positive impact. This extraordinary partnership has delivered through COVAX more than 40 million doses of life-saving vaccines to 118 participants since its first international delivery to Ghana in February this year. It also secured millions of treatment courses and diagnostic kits for low and middle-income countries. Yet, vast challenges remain. Vaccine nationalism is hindering COVAX access, slowing distribution of vaccines to the poorest and the most vulnerable. We have seen an unprecedented mobilization of resources for multiple donors, which has raised $14.1 billion for the ACT Accelerator. Yet, $19 billion is still needed to fully finance it for 2021. I call on countries to join this effort and to fully fund the ACT Accelerator. The ACT Accelerator cannot fulfill its mandate without the support of all countries. Let's also recognize that a full and truly sustainable recovery also requires us to get on track to reach the Sustainable Development Goals and achieve universal health coverage. The entire United Nations system has mobilized in support of governments around the world for a response and recovery. We are committed to working together with all partners to make the ACT Accelerator a success for all people. Thank you. Thank you.
As I said earlier, the strength of the ACT Accelerator is its wide support from governments all over the world. I'm now pleased to introduce video messages that have been sent by Gail Smith, the Global COVID-19 Coordinator from the United States of America, Karina Gold, the Minister of International Development of Canada, and Mikhail Murashko, the Minister of Health of the Russian Federation.
Greetings. I'm so honored to be here today with heads of state, esteemed guests, partners, and most importantly, the founders of ACT-A. On behalf of President Biden, we congratulate you on this important day, your 1-year anniversary. Our message to you is one of thanks. Thank you for coming together to build a platform that is enabling us to build a global response to this global pandemic. We are strong partners of ACT-A and intend to continue to be your partners, expressed not only in the substantial financial contributions we've been able to make recently, but also as we gather the learnings from this first year and based on the facts, the evidence, and the data, increase our impact and effectiveness. Partners as we champion the cause of global public health and build a world where every country can prevent, detect, and respond to these kinds of global health threats. Partners as we reach out to other donors and enlist them in this fight. So from all of us on this day, our congratulations and our thanks. You have a partner in the United States. Thank you.
Il y a de cela 1 an, nous avons dû affronter un virus qui ne respecte aucune frontière et qui a entraîné le monde dans une crise sans précédent. Tous les pays avaient besoin de tests, de traitements et de vaccins contre la COVID-19. Tous les pays devaient protéger leurs citoyens et freiner la propagation du virus. Tous les pays devaient arrêter l'émergence de nouveaux variants pour favoriser la reprise mondiale. Our health at home depends on the health of everyone, everywhere. That is why Canada has been committed to the ACT Accelerator from the start. Because the success of ACT-A is our best exit strategy from this pandemic. This unprecedented global collaboration has made remarkable progress, with WHO-approved vaccines reaching more than 100 countries in less than a year's time, with rapid test kits rolled out around the world, and with therapies old and new, saving lives and reducing suffering. This is monumental success. It is multilateralism at its best, rising to the global challenge. But now is not the time to let up our efforts. We must bring this response to scale and do so across each ACT pillar. This will ensure truly global access to safe and effective vaccines, therapeutics, and diagnostics, while strengthening the health systems to deliver them. Together, we need to reach every country. We need to support fragile health systems so vaccines get into people's arms, because as the saying goes, it's not vaccines that save people, it's vaccinations. We need to ensure this response reaches every person, especially the most vulnerable at risk of being left behind. I am proud to represent Canada on the ACT Accelerator Facilitation Council and to serve as co-chair of the COVAX AMC Engagement Group. I am proud that Canada has committed $940 million to this collaboration and more than $3 billion to the overall response. But so much more is needed, and Canada will play its part. Le moment est venu de nous mobiliser et d'appuyer les remarquables organisations partenaires de l'accélérateur ACT. Chacun doit faire sa juste part dans cet effort mondial. All countries, all stakeholders, everyone. It is the only way we can defeat this pandemic. We must act now, and we must act together.
Уважаемый господин председатель, уважаемые коллеги, прошел год со дня учреждения инициативы по ускорению доступа к инструментам борьбы с COVID-19. И мы можем с уверенностью отметить, что ACT-A стал глобальной межотраслевой инициативой, которая способствовала укреплению взаимодействия стран мира и международных организаций в усилиях по созданию, производству и справедливому распределению тест-систем, лекарственных препаратов и вакцин. Поздравляю всех участников инициативы с достигнутыми результатами. Мы приветствуем работу механизма COVAX, в рамках которого начались долгожданные поставки вакцин против COVID-19 в страны со средним и низким уровнем дохода. Надеемся, что наша главная цель – обеспечение равноправного глобального доступа к вакцинам – будет достигнута в ближайшее время. Выражаем готовность расширять наше взаимодействие с инициативой ACT-A, ВОЗ и другими международными платформами для достижения поставленных целей. Россия в это сложное время остается верной обещаниям, данным на площадке Группы 20 Всемирной организации здравоохранения, и продолжает вносить вклад в глобальные усилия по борьбе с пандемией. Мы координируем многосторонние усилия по борьбе с пандемией в рамках сотрудничества БРИКС, ШОС, СНГ. На двухсторонней основе мы осуществили регистрацию вакцины «Спутник Ви» более чем в 60 странах мира. Поставляем и локализуем производство вакцины в зарубежных странах. Провели кампанию по вакцинации дипломатического состава зарубежных представительств, расположенных в городе Москве, и направили соответствующие добровольные взносы в целый ряд агентств Организации Объединенных Наций. Уважаемые коллеги, переломить ситуацию с пандемией новой коронавирусной инфекции возможно только совместными усилиями. Мы желаем инициативе ACT-A дальнейшего укрепления и успешного функционирования во благо всего мира.
Thank you so much. And civil society organizations play a vital role in every area of health, holding leaders to account, providing technical expertise, delivering services, and giving voice to their communities. The ACT Accelerator is no exception, and it's now my honor to introduce Peter Ngola Owiti from Kenya, who is the civil society representative on the ACT Accelerator Facilitation Council.
Dear colleagues, 1 year ago we came together to form Access to COVID Tools Accelerator. But much more still needs to be done. To avoid more deaths, excess vaccines must be donated or sold to low and middle income countries. Vaccine manufacturing facilities should be accelerated in Rwanda, Senegal, and the Republic of South Africa. rapid antigen tests must be provided for broad use in low and middle income countries, the same way that the global north is using them. There is urgent need to tackle the oxygen crisis, particularly in India and Africa. Civil societies and communities should be supported and provided with enabling environment to meaningfully respond to the pandemic. Thank you.
Thank you. Finally, vaccines, diagnostics, and therapeutics would not exist at all without the private sector companies who develop and produce them. It's now my pleasure to welcome Thomas Cooney, the Director General of the International Federation of Pharmaceutical Manufacturers Association, to be followed by John Denton, the Secretary General of the International Chamber of Commerce.
In joining ACT Day last year, the biopharmaceutical industry signed up to bring to this partnership a unique expertise in the discovery, development, and large-scale manufacturing of medicines and vaccines. A year later, we can say science wins. Not one, but several highly effective vaccines have been developed at record speed and are now produced in historic quantities. As partners of ACT Day, we committed to accelerate global access to safe, effective, and affordable COVID-19 treatments and vaccines. To make this happen, we are seeing unprecedented partnerships between vaccine manufacturers from developing and industrialized countries. Yes, we have had setbacks. Some vaccine projects failed, bumps and hitches in scaling up manufacturing, and we know the world needs to do better in walking the talk on vaccine equity. However, we are still witnessing the fastest vaccine rollout ever. To end the pandemic, we must continue this journey together.
Good day. My name is John Denton. I'm the Secretary General of the International Chamber of Commerce, the institutional representative of 45 million businesses worldwide. At the ICC, we have supported the ACT, or ACT Accelerator, since its inception, as only a truly global, inclusive, and collaborative response will stop the spread of COVID and minimize its economic damage. Not only is that the right thing to do, it's also the smart thing to do. The longer it takes for us to control COVID everywhere, the greater the suffering and lives lost. Businesses shuttered, societies frayed, and nations divided. We have shown that the economic cost alone of vaccine nationalism, of failing to quickly distribute vaccines to all countries, no matter how rich they are, could amount to up to $9 trillion. Yes, that's right, $9 trillion. And the longer we wait to find the remaining 25 billion or so for the ACT Accelerator, the more these costs will grow. That is why we at the ICC believe the ACT Accelerator remains, on its first birthday, not only great health policy, but also the best possible jab in the arm for the global economy. With high effectiveness, zero side effects, and even potential to stop the spread of protectionist policies that would hamper a much-needed economic recovery. Vaccine early, vaccine and accelerate. Accelerate.
Thank you so much to all our speakers today. As I said in my opening remarks, the ACT Accelerator is a unique partnership that has involved the participation of 9 global health organizations working together to build something that's truly much more than the sum of its parts. Today, I'm delighted to welcome the leaders of each of our partners: Seth Berkley from Gavi, Philip Denton from UnitAid, Chris Elias from the Bill and Melinda Gates Foundation, Henrietta Fore from UNICEF, Emma Hane from FIND, Richard Hatchett from CEPI, Mohammed Pate from the World Bank, Peter Sands from the Global Fund, and Carl Bildt, our special envoy for the ACT Accelerator and co-chair of the group and the former Prime Minister of Sweden. Thank you all of you for your leadership and partnership, and I look forward to our continued collaboration in the months ahead as we work together to stop infections, save lives, and end the pandemic. Christian, back to you.
Thank you so much, everyone, and thank you, Dr. Tedros. Happy birthday, ACT Accelerator. Before we head into the question and answer session with these ACT principles and leads as just introduced, we'll show you a quick clip on the 12 months of the ACT Accelerator. See you in a moment.
1 year ago, world leaders launched a global solution to rapidly end the pandemic and equip countries to fight this devastating virus. The ACT Accelerator has secured more than 60 million COVID-19 tests, over $500 million worth of equipment to keep health workers safe, and nearly 3 million doses of the proven COVID-19 treatment, dexamethasone. COVAX has delivered more than 40 million vaccines to over 100 countries and economies, and ACT Accelerator-supported research continues to find the next generation of tools. But the pandemic isn't over. Societies and economies are still suffering. Our safety and security is still at risk. And history is still in the making. It's time to recommit to act together. Let's take research, production, and distribution up a gear to keep everyone, everywhere, safe from COVID-19.
Welcome back. Let me now open the floor to questions from the media. To get into the queue, please, to ask questions, please raise your hand with the raise your hand icon on your screen. And we would be happy, of course, to get as many questions for our special guests. We'll start with the first on my screen, and that's Jamie Keaton from Associated Press. Jamie? Oh, I'm very sorry, wrong here. This is Jamil Shad from Progresso. Jamil, please unmute yourself.
Yes, hello, Christian. Is President Cyril Ramaphosa still available for questions?
No, I'm afraid not. We'll have the principles available as just briefly introduced by Dr. Tedros.
Sure. Then my question is to Dr. Tedros, basically. If he allows, you have called this an outrage, the fact that it was not distributed as fast as it was envisaged. Do you think that it has been enough, what we have seen, or is it still long to go? And also this week you had a meeting with the new Foreign Minister of Brazil. What was your message to him? Thank you, sir.
We'll start with Dr. Aylward for the first part. Oh, Seth Berkley, sorry. Dr. Berkley, great if you could start with the first part. Dr. Seth Berkley from the Gavi Vaccine Alliance, please.
Well, thank you for the question. Of course, the answer is, although we are very excited, as you've heard, that we've started delivering now to 118 countries, more than 40 million doses, and also we've seen the millions of tests and diagnostics secured, this is not enough. And we have to do much more. We need to have the global supply to increase dramatically. This is going to require another paradigm shift to more manufacturing, including further voluntary tech transfers to boost production, particularly in and for emerging economies. We've heard that now theme multiple times. And we need more countries to donate vaccines because there is a limit to how many one can purchase on the open market. We really were very happy to and want to thank President Macron for his leadership with today's announcement of France donating to COVAX to be distributed equitably to lower income countries where they're needed most. I warmly welcome that and really feel that, hopefully we'll hear from other leaders similar action and urge them to do so. And I would just say that, we also heard the important point with the virus raging out of control in parts of the world and more new variants appearing, collective action and commitment to equity remains our only hope for the pandemic to end. So we're only safe if everyone is safe. And I want to, since this is the first time I'm speaking, I want to say happy birthday to my dear colleagues. So a longer answer to the answer, no, not enough. Thank you.
Thank you so much, Dr. Burke, and Dr. Aylward, please.
Thank you very much, Christian, and Jamil, thank you for the question. We had an excellent conversation with His Excellency, the Foreign Minister of Brazil, earlier this week. Appreciated everything that was being done now to step up the response, ensure the right measures are in place to slow down the crisis there. We spoke also about the important work being done in Brazil to escalate the production of vaccines, some of the challenges they were facing inside the country, and how we might be able to help in terms of ensuring the continued supply of raw materials and other materials that were needed. In the course of that, we appreciated as well the commitment from the Foreign Minister and the government of Brazil to not only be escalating production for Brazil, but they were also looking forward beyond the crisis currently faced in the country to how they might help the rest of the world as well with vaccines as they scale production, reach their own populations, or are able to do more. And then finally, the role of COVAX was appreciated, and especially the work that's ongoing to escalate deliveries to all countries, especially those hard hit like Brazil, as we go forward.
Thank you very much, Dr. Aylward, and we'll come to Priti Patnaik from Geneva. Priti, please unmute yourself.
Hi, can you hear me?
Yes, please go ahead.
This is a question for Dr. Tedros or Dr. Mike Ryan. You've often said that WHO cannot criticize member states in public, but we are wondering if you will make a statement on the elections, political rallies, and religious gatherings in the midst of the surge in India, and whether WHO had praised India a bit too soon. And as a consequence, what is the plan B for COVAX in the context of the Indian challenges? Thank you.
Thank you very much, Priti, and I'll look at Dr. Mike Ryan, who also joined us, the Executive Director for WHO's Health Emergencies Program. Dr. Ryan.
Good afternoon, everyone. Yes, and Sumi Swaminathan may be online as well, may wish to make a comment. We've been in very close contact with our regional office and our country office in supporting India in what is a very complex situation there. This is not easy for anyone who have disease that is rapidly spread. Multiple factors have driven that acceleration in cases. It is a very difficult task both to reduce the force of infection by having people adapt their behavior, not always easy in the situations that people find themselves in India, but we've got to reduce mobility, we've got to reduce mixing in whatever way we can to reduce the force of infection. The Indian government are moving to do that. There's been a huge focus on increasing COVID management and triage, and the Indian government has been scaling up oxygen production, working very, very closely with UNDP and UNICEF and others, and we've offered help and assistance in clinical management and triage and in scaling up oxygen supplies as needed. India is a very, as you know, large, populous country, complex, different situations, different epidemiologic situations in different states.
Unfortunately, we lost Dr. Ryan there.
Yeah, managing public health threats.
Dr. Ryan, we lost you for a moment. Please come back if there's more.
Okay.
Oops, now I muted him. Hold on for a second. Quick technical issue. Can we try again? Yes, please, Dr. Ryan.
Hello?
Yes, please go ahead.
Christian, where did you lose me?
I think when he spoke about
complex
oxygen.
issue, multiple states.
Yeah, just as you started with the oxygen, correct, yeah.
Yeah, no, just recognizing the role that our colleagues, sister agencies, UNDP and UNICEF, have played in supporting oxygen scale up in India. But the Indian government are moving very fast to scale up oxygen supply. We're providing technical assistance and clinical management and triaging of patients. That's really key now. We've got to save lives. We've got to have rational use of these measures, not hoarding The patients who need oxygen, the patients who need clinical care need to get it. There's a lot of fear in India right now, and the government are trying to bring calm, they're trying to bring an orderly approach. The states are doing the same. The situation is not the same in all the states. Some states are facing a much more serious situation than others. So we support the government of India, like we support all governments in facing this really, really difficult situation. It is difficult. It is not the time for recriminations. It's the time for solidarity. It's the time to move quickly together, to reduce deaths, to reduce transmission by decreasing mobility and mixing, by supporting communities and mask wearing, and where they can in maintaining social distance, and in reducing the amount of gatherings that are occurring that are driving transmission as well. This is not easy in the context of India. It's not easy in the context of any state, especially one as populous as India. So I think this is the time to show solidarity and support for what the Indian government are trying to achieve. Thank you.
Thank you so much, Dr. Ryan. And I believe Dr. Berkeley might have something to add, Seth, from the Gavi Alliance.
Yes, I will just say that we, of course, have been working closely with India on vaccine provision. The first 10 million doses from COVAX went to India. We've supported the scale-up of multiple vaccines now that are being produced in India. Of course, it is a very difficult time, and one of the challenges we've had to try to work with is how one balances the acute needs for India, where there's a very large population, but the needs for many other countries that rely on India as one of the vaccine manufacturers for the world. And that's something that we've been trying to balance, working with the manufacturers there and the government there. Thank you.
Thank you so much, Dr. Berkeley. We'll move to the next question, and that's Abdallah Wassan from Morocco. Abdallah, please unmute yourself.
مرحبا، أشكركم على اختيار سؤالي هذا، والسؤال كالتالي: ما هي نسبة استفادة المغرب من آليات كوفاكس ومن صندوق الاستجابة للتضامن لحد الآن؟ ما هو توقع المنظمة العالمية للصحة تلقيح لكلي وشامل للسكان في البلدان المنخفضة الدخل؟ شكرا. شكرا.
Thank you very much, Abdullah. I think we just heard the rest of the translation. Could I ask Seth Berkeley again from the Vaccine Alliance, please?
So thank you for that question. Of course, Morocco is part of the COVAX effort and is supported as one of the advanced market commitment countries. And so it will be receiving doses as part of that. In terms of its numbers, the numbers that it is expected to receive have been posted on our website. There is a slight delay in the supplies from the manufacturer that Morocco is receiving, but those will be coming in the next few months.
And for Dr. Elwood to add, please.
Yeah, and just in terms of the number of the amount that's already scheduled, over a third of that, about 300,000 doses, have already been shipped out. And again, as Seth said, hoping to accelerate the rest of that over the next 2 months.
Thank you for these clarifications. We'll move on to Jeremy Lange from RFI. Jeremy, please unmute yourself.
Thank you, Christian. Can you hear me?
Yes, very well.
Thanks. I just wanted to have the latest information about the CTAP and the MPP disposal of WHO. Is any manufacturer actually joined the CTAP and the MPP so far? Thank you.
Thank you very much, Jeremy. We'll give this to Dr. Simao, Maria-Angela Simao, if online.
Thank you very much, Jeremy. We do have, we are in negotiations with 4 manufacturers for diagnostics, and this is an ongoing process. So far, we have approached different manufacturers for vaccines and also the potential manufacturers for small molecules, the pharmaceuticals, but have not been successful in that extent as well. But I think we have the colleague from the director from the Medicines Patent Pool, and he can give an overview from the Medicines Patent Pool itself, because I believe they have some news on their side. Is Charles Gore online?
Yes, I am. Thank you very much, Sumia, and thank you for the question. Just like to say that to restate what Dr. Sumia said, that at the moment we're not in a position to actually get a license, but we are in discussions with a number of companies. But what is important, I think, is what President Macron said, that we really need to encourage more companies to come forward to enter into discussions to see how we could help in the response to COVID. Because, as you know, the Medicines Patent Pool was set up for another health emergency, HIV, and that allowed us to address that by increasing the number of manufacturers across the world through transparent licensing and non-exclusive licenses that allowed a very broad geographic manufacturing base, things that we need for COVID. Thank you.
Thank you very much. And this was Charles Gore from the Medicines Patent Pool, MPP. And before we had Dr. Mariangela Simão, Assistant Director General for Access to Medicines and Health Products at WHO. Next question goes to John Saracostas from The Lancet. John, please unmute yourself.
Yes, good afternoon. Can you hear me?
Very well, please go ahead.
Yes. I was wondering, going forward, if some of the experts on the panel have any out-of-the-box ideas on how to really ramp up global vaccine production. There have been some successful models in history, like in World War II, with the penicillin production, where the cooperation between the US government and pharmaceutical companies managed to produce up to 650 billion units per month. So, is there a chance for a new model?
Thank you very much, John. I'd like to start with Dr. Richard Hatchett from CEPI, and possibly followed by Dr. Ms. Henrietta Fore from UNICEF. So, Dr. Hatchett, please. Please unmute yourself, Dr. Hatchett. Sorry, Dr. Hatchett, we have no sound right now. Let me start with Ms. Fore from UNICEF, Executive Director first, and otherwise we try you again. Sorry. Ms. Fore, please.
Thank you. I'm sorry. I'm responding to an earlier question, which came from the gentleman from Morocco, on what we are doing to help other countries. So I just wanted to mention that as an alliance, cold chain in countries, so solar-powered refrigerators, the training of healthcare workers, the help in getting vaccines out into the countryside by every possible means, and to get the community workers to carry a sense of trust so that people feel good about getting a vaccination and that vaccines move from the tarmac into the arms of the people who need it. Thank you.
Thank you very much, Ms. Fore. And we'll try again for Dr. Hatchett from CEPI if we have a better sound now. Oh dear, unfortunately not. Very sorry for that, Dr. Hatchett, and for all who can't hear this now. We'll possibly try it again
Chris,
later.
Do you want me to say something at Seth?
Yes, please, go ahead.
Yeah, so you're absolutely right. We do need a spectacular increase in volume of production. The world produces somewhere around 4 to 5 billion doses, and what we're talking about is a tripling or quadrupling of production. The first priority, which I know Richard would have talked about, is right now we're seeing supply constraints, and that is stopping vaccine production right now. For example, we know of one company that has over 20,000 liters of production capacity, but they have not been able to produce vaccines because they don't have the raw materials and equipment they need to do that. The second thing that's critical is making sure that everybody who has the ability to produce vaccine is part of this. And CEPI is, as part of the COVAX Manufacturing Task Force, reaching out to all manufacturers on the world now to relook at what the capacity is now. They did this a year ago, but things have changed so much to see, are there additional places to go? And the last issue will be, of course, trying to move into new capacity development. Of course, that takes more time, but there is an active discussion on how that might be done to move forward. So it is a very important part of what we do. Of course, we don't know, will we need boosters because of waning immunity? Will we need new vaccines because of variants? Will we need boosters for variants? So regardless of any of those three issues, we will need more vaccines. So we're all working together to try to see how we can get there as quickly as possible. Over.
Thank you very much. And this was Dr. Seth Berkley from the Gavi Vaccine Alliance. Dr. Emma Hanay from FIND wanted to add on the diagnostics. Dr. Hanay, please.
No, there was nothing else from my end to add on those questions so far.
Sorry for the misunderstanding, and I'm asking Dr. Philip Dunton from Unitaid if he wanted to ask. No, I don't see anything. Then we move on to the next question.